Below are 50 MCQs with answers and one-sentence rationales covering clinical enzymology and its application to nursing clinical practice. Clinical enzymology, 50 MCQs with answers and rationales. Isoenzymes, definition and properties, 1 to 10. 1. Isoenzymes are best defined as A. Enzymes that differ in substrate, B. Enzymes with identical function but different structures, C. Enzymes made only in the liver, D. Enzymes activated by metals. Answer. B. Rationale. Isoenzymes catalyze the same reaction but differ structurally. 2. Isoenzymes differ mainly in their A. Km only, B. Chemical reaction, C. Amino acid sequence and physical properties, D. Substrates. Answer. C. Rationale. Structural differences cause variations in electrophoretic mobility and kinetics. 3. Which method is commonly used to separate isoenzymes? A. Colorimetry, B. Electrophoresis, C. Osmotic pressure, D. Osmometry. Answer. Rationale. Isoenzymes vary in charge, allowing separation by electrophoresis. 4. Lactate dehydrogenase LDH has how many major isoenzymes? A. 2, B. 3, C. 4, D. 5, and D. Rationale. LDH exists as 5 tetrameric isoenzymes. 5. CKMB isoenzyme is most abundant in A. Brain, B. Liver, C. Cardiac muscle, D. Smooth muscle. Answer. C. Rationale. CKMB predominates in myocardium. C. Which isoenzyme pattern indicates myocardial infarction? A. LDH1, LDH2, B. LDH1, LDH2 flip pattern, C. LDH5 predominance, D. No change in LDH. Answer. B. Rationale. LDH1, LDH2 flip is classic for MI. 7. ALP isoenzymes are most useful in distinguishing A. Liver versus bone disease, B. Kidney disorders, C. Thyroid disorders, D. Lung diseases. Answer. A. Rationale. ALP isoforms help differentiate hepatobiliary from bone conditions. 8. Which isoenzyme is heat labile? A. Bone ALP, B. Liver ALP, C. Placental ALP, D. Intestinal ALP. A. Rationale. Bone ALP is inactivated by heating compared with liver ALP. CKBB is mainly found in A. Muscle, B. Liver, C. Brain and smooth muscle, D. Heart. Rationale. CKBB is the brain smooth muscle isoform. 10. A persistently elevated ALP with normal GGT suggests A. Liver disease, B. Bone disease, C. Pancreatitis, D. Answer. B. Rationale. GGT helps confirm if ALP is hepatic. Normal GGT suggests bone origin. Liver disease enzymes, ALT, AST, ALP, GGT, 11 to 20, 11. The most specific enzyme for liver cell injury is AAST, C. ALP, D. GGT. Answer. B. Rationale. ALT is more liver specific than AST. 12. AST is also elevated in A. Kidney failure, B. MI and muscle injury, C. Hypothyroidism, D. Diabetes. Rationale. AST is found in liver, heart, and muscle. 13. A high AS ratio is typical of A. Viral hepatitis, B. Alcoholic liver disease, C. Obstructive jaundice, D. Cirrhosis only. Answer. B. Rationale. Alcohol-induced mitochondrial damage elevates AST disproportionately. 14. ALP markedly increases in A. Viral hepatitis, B. Obstructive jaundice, C. MI, D. Renal failure. Answer. B. Rationale. Cholestasis increases ALP from bile canalicular cells. 15. GGT is primarily used to confirm A. Bone disorders, B. Hepatobiliary origin of ALP elevation, C. Muscle injury, D. Thyroid disorders. Answer. B. Rationale. GGT rises in cholestasis but not bone disease. 16. A nurse sees high ALP with high GGT on labs. This suggests A. Bone disease, B. Hepatobiliary disease, C. Normal aging, D. Muscle injury. Answer. B. Rationale. GGT elevation confirms hepatic source. 17. Which enzyme increases earlier in alcoholic liver disease? A. ALT, ALPC, GGT, D. LDH. Answer. E. Rationale. GGT is sensitive to alcohol use. 18. Elevated ALP in pregnancy mostly comes from bone, B. Liver, C. Placenta, D. Muscle. Answer. C. Rationale. Placental ALP increases physiologically. 19. ALT is located in which cellular compartment? A. Mitochondria only, B. Cytoplasm, C. Nucleus, D. Cell membrane. Answer. B. Rationale. ALT is mainly cytoplasmic. 20. AST exists in A. Cytoplasm only, B. Mitochondria only, C. Both cytoplasm and mitochondria, nuclei. Answer. C. Rationale. AST is both cytosolic and mitochondrial. Myocardial infarction enzymes, CK, troponins, AST, LDH, 20 to 35. 21. The most specific enzyme marker for MI is A. CKMB, B. Troponin 1T, C. AST, D. LDH. Answer. B. Rationale. Troponins are highly cardiac specific. 22. Troponin levels remain elevated for A. 6 hours, B. 24 hours, 7 to 10 days, D. 3 hours. Answer. C. Rationale. Troponins have a prolonged elevation after MI. 23. CKMB rises within A. 1 hour, B. 4-6 hours, C. 24 hours, D. 48 hours. Answer. B. Rationale. CKMB begins rising 4 to 6 hours post-MI. 24. LDH1, LDH2 flip is seen after A. Viral hepatitis, B. MI, C. Bone disease, D. Renal failure. Answer. B. Rationale, MI increases LDH1 leading to flipped ratio. 25. Which marker peaks first in MI? A. LDH, B. troponin, C. CKMB, D. ALP. Answer C. Rationale, CKMB has an early peak 24 hours. 26. LDH peaks at A. 24 hours, B. 48 hours, C. 72 hours, D. 12 hours. Answer C. Rationale, LDH peaks 2 to 3 days post-MI. Which enzyme is least specific for MI? A. CKMB, B. troponin, C. AST, D. LDH1. Answer C. Rationale, AST is present in liver and muscle as well. 28. In MI, CKMB returns to normal within A. 12 hours, B. 24 hours, C. 2 to 3 days, D. 10 days. Answer C. Rationale, CKMB normalizes by 48 to 72 hours. Troponin is preferred over CKMB because A. cheaper, B. more specific and sensitive, C. faster turnaround time, D. not affected by kidney disease. Answer B. Rationale, troponins detect even minor myocardial injury. 30. A second peak of CKMB indicates A. recovery, B. reinfarction, C. dehydration, D. allergy. Answer B. Rationale, CKMB re-elevation suggests a new MI. 30 chest best identifies reinfarction within 48 hours. A. troponin, B. CKMB, C. ALP, AST. Rationale, CKMB returns to baseline sooner, making rises evident. 32. Troponin elevation can also occur in A. bone injury, B. chronic renal failure, C. fractures, pneumonia. Answer B. Rationale, renal failure reduces troponin clearance. 33. LDH5 is elevated mainly in A. liver disease and muscle injury, B. brain injury, C. MI, D. prostate cancer. Answer. Rationale, LDH5 predominates in liver and skeletal muscle. 34. The earliest MI marker overall is A. myoglobin, B. CKMB, C. troponin, D. Answer A. Rationale, myoglobin rises within 1 to 3 hours. 35. A nurse notes high troponin with normal CKMB. This suggests A. very early MIB, non-cardiac injury, C. chronic elevation, D. lab error. Answer C. Rationale, troponins can remain elevated long after CKMB normalizes. Muscle diseases, CK aldolase 36 to 40. 36. The best enzyme for diagnosing skeletal muscle diseases, A. ALT-CK-DALP. Answer C. Rationale, CK is highly sensitive to muscle injury. 37. Aldolase increases in A. bone disorders, B. muscular dystrophy, C. hepatitis, D. MI only. Answer B. Rationale, aldolase levels rise in muscle fiber breakdown. 38. CK levels are extremely high in A. viral hepatitis, B. rhabdomyolysis, C. diabetes, D. cirrhosis. Answer B. Rationale, severe muscle breakdown releases large amounts of CK. 39. CKMM fraction is highest in A. Harvard, C. skeletal muscle, D. brain. Answer C. Rationale, CKMM dominates skeletal muscle tissue. 40. A normal CK with elevated aldolase suggests A. acute MI, B. chronic muscle disease, C. bone disease, D. renal failure. Answer. Rationale, aldolase may remain high in chronic muscle injury even when CK normalizes. Bone diseases, ALP 4044. 41. The most important enzyme in bone disorders is A. ALT-CC ALP troponin. Answer C. Rationale, ALP reflects osteoblastic activity. 42. ALP is elevated in A. osteomalacia, B. heart failure, C. liver failure only, D. kidney stones. Rationale, increased bone turnover raises ALP. 43. Paget disease typically shows A. low ALP, B. normal ALP, C. very high ALP, high ALT. Answer C. Rationale, excessive bone remodeling elevates ALP. ALP elevation with normal GGT suggests A. cholestasis, B. bone disease, C. MI, D. pancreatitis. Answer. Rationale, GGT helps distinguish bone versus liver ALP origin. Prostate disease, PSA ACP 45 to 50. 45. The most important marker for prostate cancer is A. ALP, B. ACP, PSA D. CK. C. Rationale, PSA is highly sensitive for prostate pathology. 46. ACP was historically used to detect A. diabetes, B. prostate cancer, C. MI, D. cirrhosis. Answer. Rationale, prostatic acid phosphatase was an older marker for prostate cancer. 47. PSA levels may increase in A. MI, B. pH and prostatitis, C. lung disease, D. renal failure. Answer B. Rationale, PSA is elevated in benign and inflammatory prostate conditions. 48. Very high PSA, 20 nanograms per milliliter, suggests A. prostatitis only, B. high likelihood of cancer, C. bone fracture, D. hepatitis. Answer B. Rationale, extremely high PSA values are suspicious for malignancy. 49. Which form of PSA is most sensitive for cancer? Free PSA, bound PSA, C. total PSA, D. heat denatured PSA. Answer C. Rationale, total PSA measurement is most sensitive. Free total ratio adds specificity. 50. A low free PSA total PSA ratio indicates A. benign disease, B. higher risk of prostate cancer, C. normal prostate, D. muscle injury. Answer. Rationale, lower free PSA ratios correlate with malignancy risk. Thank you. Have a nice day.